Hi there, my name is Gracie Wood, and this is my capstone presentation for Nursing 4741 at Midwestern State University over pain management practices in the neonatal ICU. Knowing that effective pain management reduces complications regarding patient function, quality of care, and quality of life, consideration of pain management techniques are important to nursing practice. For much time, it was thought that the neonate did not feel pain to the same intensity as other patient populations. However, recent research has established that the neonate does feel pain. They in fact feel it hypersensitively, and they act to circumvent pain while forming memory traces of painful experiences. With the idea that neonates do not feel pain, many invasive procedures and interventions that would normally require pain management interventions in children and adults are performed with no provision for pain in the neonate. This poses an issue as untreated pain in the neonatal stage may contribute to a number of future implications on quality of life. The neonatal population is a vulnerable population who is unable to advocate for themselves. Thus, it's important that this research is discussed and best practices determined. This information would impact the clinical organization by informing the medical team of the peer-reviewed research conclusions and proposals for changes in care regarding addressing pain in the infant. The objective of this presentation is for members of the audience to identify the gap that exists in current research and any gaps that exist in their knowledge of neonatal pain and current practice. In comparison to current evidence-based research, and through the evaluation, the member of the audience will be able to understand the long-term implications of pain for the infant in the neonatal ICU. With this knowledge, the individual will be able to discuss and provide education on the implementation of a proposal plan that contains both pharmacological and non-pharmacological pain management practice standards for the NICU. One of the key components of patient care is the prevention of pain, a fact that's affirmed by the World Health Organization and the Academy of Pediatrics, who highlight the importance of pain prophylaxis in the neonatal population. Despite this new evidence, there's still a lack of pain management standards and criteria for the neonatal population in current practice. There are over 40 pain assessment scales to assess neonatal pain, which, while providing many options, also creates confusion and inconsistency in pain assessments. Additionally, there are a number of non-pharmacological and pharmacological pain management techniques that are available, but due to the lack of knowledge and practice, they're rarely used effectively or in conjunction with each other. In light of the knowledge that neonates do feel pain hypersensitively and implications that untreated pain leads to long-term consequences, there's an increased need for research and education, as well as development and implementation of consistent pain management standards and interventions for the neonatal population. Until the 1980s, it was a common perception among healthcare workers that neonates were incapable of feeling pain. Thus, the pain management interventions that were available for children and adults undergoing painful stimuli were not available or researched for the neonatal population. In 2015, a research project conducted by Oxford performed and evaluated the MRIs of neonates when exposed to painful stimuli and compared them to an adult exposed to similar painful stimuli. The results of the study revealed that the infant's brain showed activity in 18 to 20 brain regions that are present in the adult exposed to the similar stimuli. With this, it was determined that the neonatal pain feels and experiences pain more intensely than the adult. The implications for untreated pain in the neonate include increased pain sensitivity later in life, increased avoidance behaviors, decreased immune function, hypervigilant behaviors where the neonate is constantly assessing potential stressors around them, neurodevelopmental deficits, impaired concentration, and other cognitive functions, as well as physical, psychological, and emotional disturbances. Because of the long-term effect of each of these implications, it's vital that repeated and prolonged painful experiences be addressed. This is done through the evaluation of current practice standards relative to the results of this research and modification of best practice to provide adequate pain management for all neonatal patients through consistent evaluation of pain and development of best practice standards. This presentation will focus on the following PICO statement. In the neonatal intensive care unit, how does the incorporation of pharmacological pain management interventions compared to non-pharmacological pain management interventions affect the outcome of the neonate? The literature review parameters used were the databases Sinahal, PubMed, EBSCO, and Google Scholar. Keywords used were the NICU and ICU, pain management, pain scale, practice standards, neonatal pain. The filters used were 2016 and up so that the articles were within the past 5 years, with the full article available, and articles that were written in English. With these parameters, ample research was available regarding pain perceptions, assessment, current practice, deficits, effects, and implications for pain management in the neonate. Neonates may undergo over 300 procedures and painful interventions throughout their hospitalization. Because of the immature development of the neonatal population, pain assessment is difficult. Currently, the recommended neonatal pain assessment scales are the NPAS scale, the Comfort Neo scale, the NIPS, and the FLAC. Pain, when untreated, can cause long-lasting consequences. Prior to both pharmacological and non-pharmacological interventions, it's important to note that reducing the overall number of procedural interventions, regularly assessing pain, and providing prophylactic pain control interventions is essential in preventing pain. Non-pharmacological interventions that are typically used in a NICU include sweet-tasting substances, kangaroo care, breastfeeding, and therapeutic swaddling and tucking. Pharmacological interventions include opioid and non-opioid medications, topical anesthetics, and regional anesthetics. And the collaborative use of pharmacological and non-pharmacological interventions in conjunction provide a synergistic analgesic effect in order to prevent complications from untreated pain. Ultimately, the goal is that the healthcare team is able to determine best practice standards, as well as guidelines and interventions that will overall decrease the pain exposure. When determining pharmacological versus non-pharmacological pain management interventions, the healthcare team must consider more than just the acute indicators of pain like crying, but also consider long-term effects of pain on the neonate. Non-pharmacological interventions like sucrose and swaddling should be used prophylactically prior to any painful stimuli. Through a 2021 study assessing healthcare professionals' perceptions of neonatal pain interventions, gaps in education were identified, indicating that despite recommendations and evidence-based guidelines, research shows that the problem of pain among patients in the NICU is an important yet neglected problem. Similarly, another 2021 article study surveyed 145 NICU physicians, and 90.6% of these physicians stated that they believe that neonates experience pain and that this pain can cause acute and serious long-term consequences, but that knowledge did not change the utilization of pain assessment tools and protocols, and that usage remained low. Knowing that controlling pain in the neonatal population is essential in improving physiological, behavioral, and hormonal outcomes, determining protocols and tools for assessment and intervention would improve pain management in the NICU. Because the neonatal population can't verbalize their pain, it's the job of the nurse to consistently assess and intervene to prevent future complications caused by pain. The stakeholders would be the neonatal patients as well as the physician and the healthcare team. Each of these groups have a heavy interest or concern regarding pain management, as it affects their job duties in prescribing, administering, and assessing, as well as directly affects the patient and their overall quality of life and quality of care. Through review of evidence and best practice standards, new pain management standards can be proposed and set for the neonatal ICU, but this only comes through the education of all stakeholders, research, discussion, proposal, implementation, and evaluation. Consistent pain assessment of the neonate should be done prior to and after implementation of pain management interventions to help better evaluate the effectiveness of the interventions, both pharmacological and non-pharmacological. This pain assessment should not be subjective to the one assessing, but objective across all patients, thus requiring consistent use of a neonatal pain scale. Each unit should discuss which pain scales that they're most comfortable using and experienced with, and use this knowledge to implement a standard pain management scale on their unit. Determining the best pain scale may come from trial and error based on research, but the neonatal infant pain scale, also known as the NIPS scale, is the one that's been implemented effectively across neonatal intensive care units. Education that will need to be provided to the stakeholders will begin with an evaluation of their current perception of neonatal pain. After this is identified, education on the neonatal pain assessment tools should be used in order to ensure consistent, accurate, and timely assessment of the pain of the neonate. Education will also need to be given to physicians regarding the prescription of pain management medications for neonates, as well as to the healthcare team regarding administration and evaluation. Education should also be given to the guardian of the neonate regarding care being given and long-term effects of proceeding with pharmacological intervention as opposed to only non-pharmacological. Similarly, the healthcare team should be educated in weighing the benefits and risks of the pharmacological versus non-pharmacological neonatal care so that decisions are being made in light of the patient's best interest. Standards that are implemented should then be evaluated for effectiveness regarding long-term effects of the pain pain on the neonate, with pharmacological intervention versus with non-pharmacological intervention, as well as conjunctive therapy. Through implementation of this proposal, more consistent assessment and treatment of neonatal pain would occur, allowing for proper identification or long-term effects, and new best practice standards to be adjusted as evidence evolves. Limitations and barriers that may be present in implementing this proposal include poor coordination between the key stakeholders, opposing opinions of the key stakeholders, and unwillingness to accept new evidence or conflicting unit policies. In evaluating the outcomes of the effect of non-pharmacological and pharmacological interventions for the neonatal pain, I would develop a survey that assesses the pain after the intervention and then follows up to determine any longer-lasting effects. This is important because accurate assessment of the pain post-intervention is the only way to determine effectiveness, and this can be done through a neonatal pain assessment scale that we discussed previously and through the physiological signs and changes in vital signs. Ultimately, this evaluation will lead to determination of harmful effects of untreated and unrelieved pain on the physical condition, emotional, and psychosocial development of the neonate, and those are all able to be identified in the role of pharmacological and non-pharmacological interventions. The goal of this proposal is to determine a best practice clinical guideline for neonatal pain management so that best practice can be implemented and the vulnerable patient population of neonates are treated with high quality, efficient, and comfortable care. Continuing education for nurses is essential in maintaining practice up to date with evolving healthcare knowledge. In disseminating this proposal via CEUs, the first step is determining the content, determining participants who need CEU hours, and selecting a schedule and facility to hold continuing education presentation at is next. Next would be selecting a certified instructor who believes in the research that they're teaching and have evaluated and support the outcomes. When taught by a qualified instructor, CEU hours may be awarded, which may motivate individuals to obtain this education and implement results. Through implementation of this proposal and the evaluation of outcomes, information and results would then be published nationally, detailing the parameters and actions in the study with the goal of informing neonatal healthcare teams nationally. This proposal relies heavily on a nursing staff that's committed to learning and adapting as research changes. So, being educated on current research available about neonatal pain is essential in the implementation of this proposal. This information may be dispersed through PowerPoint or Prezi presentation, through an online interactive unit, or through incentivized in-service opportunities. Through the information that I obtained in a discussion with a long-term NICU RN and research, in disseminating this proposal, the first step is evaluation of their current pain management practices on a NICU unit. Having each participant detail their perceptions of neonatal pain and consideration of the long-term ramifications of the painful procedures. Next, they should identify their unit's current pain assessment tools and pain management practices, including prophylactic pain management standards. Then, the expert instructing the course, or a predetermined online module, will educate on the signs of pain in the neonate. Signs of pain in the neonate include increased heart rate and respirations, dropping oxygen levels, crying, kicking, or fighting to get out of their blanket or swaddle, and changes in vital signs for the intubated infant. When these signs are observed, a consistent pain scale should be utilized, like the NIPS scale, with the results being recorded consistently. Pharmacological and non-pharmacological protocols should exist to aid in consistent interventions. These interventions may include swaddling in a pacifier with glucose water for procedures like a heel prick, glucose water, and arm swaddling during circumcisions, and lidocaine for circumcisions or lumbar punctures. Kangaroo care may be utilized during procedures like immunizations. Prophylactically, developmental positioning should be utilized as it attempts to mimic the womb environment as much as possible by using positioning devices like bendable boundaries and swaddle techniques. This enables the brain to develop and prevents unnecessary stress to the infants on an everyday basis, even when they have to endure the needed labs and other painful procedures that are associated with the NICU stay. In conclusion, the neonatal population is one that requires the healthcare team to advocate for them, as they cannot speak for themselves. This requires being committed to the knowledge and education, open to new research, and implementing new practices, as well as being committed to the overall health and well-being of the patient. When it comes to pain, pain is considered the fifth vital sign because of its effect on the patient's health status and outcome. So when addressing the complicated topic of neonatal pain, it's important that the nurse is educated on the different types of assessments. With a variety of pharmacological and non-pharmacological interventions available, understanding the effect of the long-term life of the neonate is essential in caring for this patient. Through the implementation of practice standards that are in line with current research, the nurse is able to evaluate the effect of each intervention on the outcome of the neonate, which ultimately provides the ability for continued growth and education in the topic of neonatal pain. Thank you guys so much for listening to my presentation. I'll link the references in the caption below. And that is all I have for you. Thank you.